Let's now discuss internally generated dampness as we continue with diagnosis according to pathogenic chi. Internally generated dampness is primarily a consequence of spleen chi deficiency or spleen yang deficiency. It can also result from consuming foods, beverages, and medicine that produce dampness or damp heat. As with exogenous dampness, it is important to differentiate between whether there is damp cold or damp heat, as well as where in the body the dampness is. Now let's delve into its etiology. Internally generated dampness can arise when the spleen or the kidneys are too weak to carry out their functions of transforming and transporting fluids in the body. Dampness can also result from a prolonged or excessive consumption of foods, beverages, and medicine that produce dampness or damp heat. Dampness can start as an acute invasion of exogenous dampness that has penetrated into the interior and become a chronic interior condition. So for its symptoms and signs, the general symptoms and signs of internally generated dampness are as follows: nausea, loss of appetite, heaviness in limbs, fatigue, abdominal bloating, loose stools or diarrhea, increased vaginal discharge, cloudy urine, sticky taste in the mouth, lack of thirst, slippery pulse, and a thick and sticky tongue coating. So let's discuss further the symptoms and signs of specific internally generated dampness patterns. So first we have stomach and spleen dampness. This can manifest with poor appetite or no appetite in the morning. There's nausea, blocked or replete sensation in the epigastric region or abdomen. There's loose stools or diarrhea, sticky taste in the mouth, lack of thirst, loss of sense of taste, heaviness in the arms and legs, white, sticky discharge from the vagina, edema, fatigue, heaviness in the body and head, fuzzy thinking or feeling as if the head is full of cotton wool, dull, pale complexion, thick, white, sticky tongue coating on a pale tongue. In a chronic pattern, the coating may not be so thick and there is a slippery or slow pulse. In dampness in the intestines, there is diarrhea or loose stools that are watery and odorless. There's borborygmi, heavy, uncomfortable or replete sensation in the abdominal cavity, abdominal bloating, nausea, vomiting, lack of thirst, thick, white, greasy coating on the tongue, and a slippery pulse, especially in the third position. In damp heat in the intestines, there is explosive diarrhea, sticky, odorous stools, burning sensation in the rectum. The stool may be bloody, and there is thirst without desire to drink. There's flatulence, odorous flatulence, dark urine, oily or sticky sweat, sticky yellowish tongue coating, raised red papillae on the root of the tongue, and rapid and slippery pulse, especially in the third position. In dampness in the urinary bladder, there is turbid or oily urine, difficult or obstructed urination, frequent but scanty urination, heaviness, tightness, or obstructed sensations above the pubic bone, white, oily coating on the root of the tongue, slippery and tight pulse, especially in the left third position. In damp heat in the urinary bladder, there is a dark, cloudy, odorous urine. There may be blood in the urine, frequent scanty urination with burning sensation, yellowish and oily coating on the root of the tongue. There may be raised red papillae on the root of the tongue, a rapid and slippery pulse, especially in the left third position. Next is dampness in the uterus. There is watery, whitish discharge from the vagina that is odorless or smells like fish. There's sticky white tongue coating in the root of the tongue, a slippery pulse, especially on the third positions. In invasion of damp heat in the uterus, there is yellowish, sticky discharge from the vagina that is very odorous and smells of leather. There may be vaginal itch and the mucosa may be red. There is sticky yellowish coating on the root of the tongue, a rapid and slippery pulse, especially in the third positions, and all symptoms and signs will be acute. In dampness in the liver, there is sore, painful or swollen genitalia, weeping sores on or itching in the genital region, hypochondriac region. There is vaginal discharge, difficult urination, impotence, sticky coating on the root of the tongue, the slippery or wiry pulse, and especially on the left guan position. In dampness in the gallbladder, there is costal pain, heaviness, nausea, sticky taste in the mouth, thick coating on the side of the tongue, a slippery or wiry pulse, especially on the left middle positions. In damp B, this is B syndrome in which dampness is the predominant pathogen. The pain will be heavy and dull, and there often will be numbness. There will usually be swelling around the joint, possibly also edema. The pain is never sharp and will usually have arisen gradually. The symptoms will be affected by humid climates and environments. There will be general sensation of fatigue and heaviness. The tongue can be wet with a thick, sticky coating, and the pulse will be slippery or soggy. In damp heat in the joints, there will often be several joints that are simultaneously affected. The joints will be sore, painful, swollen, and red, and will feel warm when palpated. The person will often have additional characteristic heat signs such as a red face, thirst, rapid pulse, and red tongue. And finally, dampness in the skin, there will be exuding skin disorders. Thank you for your attention.